Hello everyone, how are you? Today we are going to start another question regarding MRCS based on eMRCS. We will discuss all the question regarding MRCS like eMRCS, recalls, Fawzia sheets and other question which is required for MRCS. So if you new in this channel, you can subscribe for next videos which will help you to pass in MRCS exam easily. And it is important that it is an important information. We will deliver at least 2 videos in 24 hours, so it will be very helpful for you to pass in MRCS exam. So let's have the question. So here the question: a 43 years old lady is recovering following a live donor related renal transplant. She has significant abdominal pain. Which of the following analgesic drugs should be avoided? So here we can see a 43 years old lady is recovering following a live donor related renal transplant. So here renal transplant, that means she have taken kidney from one of the donor, and after that she has significant abdominal pain. She developed abdominal pain. For abdominal pain, we have to choose a painkiller to reduce the pain of the patient. Which of the following analgesic drug should be avoided? Here we can see there are different options, such as here you can see paracetamol, morphine, nefopam, diclofenac, codamol. So here there are different painkiller. We have to choose the painkiller which usually don't impair the function of the kidney, because she has the kidney which is not her own. So the kidney cannot function. It is 100%. It usually acts below 100. So if we give a drug which is not kidney friendly or which can cause kidney damage, it will be very harmful for the lady and for her kidney. So for save of the kidney, we have to prepare a painkiller which will be very helpful for this patient. So we can see here paracetamol, morphine, nefopam, diclofenac and cocodamol, and we all knows that NSAID is not kidney friendly and it hampers the function of the kidney by inhibiting the prostaglandin A. So here we can see the explanation. Non-steroidal anti-inflammatory drugs or NSAID may be nephrotoxic. Actually, NSAID is usually nephrotoxic and therefore are usually avoided in patients who have undergone renal transplant. So, in case of renal transplant patient, we have to avoid the NSAID to give a kidney friendly environment of the patient. On the other hand, we can see here paracetamol, paracetamol and morphine. Paracetamol and morphine, two important drugs, they are metabolized predominantly in the liver. So paracetamol and morphine can be given to the kidney patient because it excreted or it is biotransformed by the liver. There are some renal contribution to morphine metabolism and excretion, and the drug should be administered in reduced doses or avoided if the transplanted kidney stop functioning. So here another important point, that the morphine is usually metabolized by the liver, but some part of the morphine is excreted by the kidney. So we have to reduce dose in case of kidney transplant patients during the kidney is non-functioning or stop functioning or reduced it is functioning. So in case of choosing painkiller for the kidney patient, we have to give the painkiller in the reduced dose. So here we can see, finally we can give the renal transplant patient other than the NSAID drugs such as paracetamol, morphine, nefopam, cocodamol, because they usually metabolized by the liver. But diclofenac, it is metabolized and excreted partly by the kidney, and diclofenac, it reduces the function of the kidney by inhibiting the prostaglandin E2. So when the kidney reduce the prostaglandin E2, there is a reduced blood supply to the kidney that causes ischemic changes of the kidney and injury of the kidney, and it should be avoided in case of renal transplant patient. Thank you all.